whenever a patient wants to whiten their teeth, first of all, I never bring it up. I don't think that's something a dentist should bring up because that's a very personal decision. And if they do bring it up, I'll say, let's try, are you using a nano-hydroxyapatite-based toothpaste? If they're not, I would say use that for 6 weeks and let me know. Come back and let me know. It's inexpensive, it works, it's safe, and it's better than the whitening process that dentists use. And then there's the over-the-counter version, which is even worse and more dangerous. Let's try that first. And as it turns out, when nano gets incorporated back into the tooth structure, the enamel line, the crystalline structure of enamel, it's an apatite structure. That's a crystalline circular structure. It's a mirror finish. Fluoride actually is very electronegative. It gets pulled into remineralization cycles as well, but it's a wavy, brittle surface, and so it becomes a very dull finish. Nano-hydroxyapatite, on the other hand, is a very smooth, reflective. It has high reflectivity. So it's not necessarily the color that changes, but the teeth become a lot shinier. And a lot of people, I would say at least 20%, are satisfied with that result because it's really biomimetic. It's the way our teeth were meant to look. It's biomimetic is a material that is found in the body, and that's what's being added to a nano-hydroxyapatite toothpaste, and that works well. If you do want to whiten your teeth, then you have to use a tray-based system with a strong oxidizer, hydrogen peroxide-based, and that has issues. It can damage tooth structure, pulpal tissue if overused, and also, this doesn't get discussed that often, it's hard on the oral microbiome.
Okay.
So I would try, hydroxyapatite does have a whitening effect. And people are surprised by that. And the question is how white do you want your teeth? If you want them paper white, I don't think hydroxyapatite will work, but that's because that's not what nature intended. So then but try that toothpaste for 6 weeks first. That may do the trick. There is a whitening effect, and it's based on reflectivity and the surface structure, less brittle, smoother finish, as opposed to fluoride. Fluoride could actually be making your teeth look dull, believe it or not. And also systemic health. If you're not a healthy person, your pulp chambers will be affected, the health of the tissue inside the teeth, and your teeth will yellow from the inside out.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Most acidic drinks like kombucha and a lot of mineral waters, Perrier, for example, they're pretty low. Coffee, wine, iced tea, my favorite, those start off at a low pH. And if you're drinking a lot of that,